guys. I recently shared a little bit of information about birth trauma and some of the things that can contribute to a woman's experience of trauma during her labor and delivery or birth experience. And today I just want to follow up with a little more information specifically about PTSD or post-traumatic stress disorder following the birth experience. As many as 34% of women report their birth experience to be scary or traumatic in some way, and statistically we think as many as 9% may go on to actually experience what we would consider clinically post-traumatic stress disorder or PTSD. Some of the experiences during labor and delivery that can contribute to a PTSD response might be a severe medical complication during the labor and delivery, maybe an injury or third, fourth degree tearing during the delivery. If there was a prolapsed cord and a unplanned or emergency C-section, that can result in PTSD for the mom. If the baby goes to NICU, baby has health issues and has to go to the neonatal intensive care unit, that can result naturally in some PTSD for mama. Even if there's just feelings of powerlessness or poor communication with her providers, a feeling of being alone, without any support, without reassurance during her delivery, this can actually go on to create some feelings of fear and anxiety and PTSD for mom after the baby is born. So what does PTSD look like? How do we know if what you're experiencing is considered post-traumatic stress disorder? Some of the symptoms may include intrusive, recurring, re-experiencing thoughts about the birth experience, flashbacks or nightmares, maybe being avoidant of places or people, medical offices, people who you associate with the experience. You may be feeling feelings of avoidance to them, increased arousal or irritability, being anxious, feeling keyed up or hypervigilant, easily startled, just kind of like you're always on. That's a symptom. Feeling anxiety or even having panic attacks can be a symptom of PTSD. Or for some moms, they may experience a feeling of detachment, like they are not in reality, not living in reality. That can also be a symptom of PTSD. So what do you do if you're experiencing any of these? If your birth experience was traumatic and now you are having a little bit of difficulty adjusting to life as a new mom, or maybe even some years later, feeling like your birth experience was traumatic and you just haven't really resolved what that experience was for you, give me a call, because this is a specialization of mine. I can relate to birth trauma, and I know how to help mamas who have been there and who are experiencing some post-traumatic stress from their labor and delivery experience. So let me know. I would love to support you. All right, take care.